in terms of advantages of Ponseti treatment, in the past, what we tend to do with clubfoot are surgery. So you will have to release all the tight structures and all the joint capsules in the foot, which involve major surgery. Sometimes, even during the surgery, we may have difficulty in closing up the skin and things like that. Unfortunately, though, the operations are very good in terms of correcting the deformity, but later on we found out that this operation tends to cause a lot of stiffness in the foot, because for a normal foot to function, you really need it to be flexible. As you're walking on uneven surface, the foot has to adapt. Even though you have a perfectly looking foot, if it's rigid and it doesn't move, then you have trouble. Because what happens is that is going to cause strain onto the rest of your joint, what we call proximally. However, the Ponseti methods, the advantage is it doesn't require any major surgery, so that the joint and the bones are maintained. So what it involves is it involves a weekly manipulation of the foot, where we slowly manipulate and correct the position of the joint and the bones. After that, any tight structure, normally is the Achilles tendon, we did a very simple tenotomy, where we cut the tendons to allow the foot to correct its position in terms of from being facing down like a horse, we pull the foot up to become what we call a plantigrade position. Now, this method, because it doesn't violate the joint and the bones, hence once the correction is achieved, the foot are still very supple, means it's still very soft and it can adapt to various shapes. That is the reason why Ponseti method is by far, at the present moment, in my view, is still the best methods for treatment of clubfoot.